Hello everyone, thank you for watching this video where I will be telling you about our MSc Women's Health programme here at the Institute for Women's Health at UCL. My name is Dr. Suzy Buckley and I'm the Programme Director for this course. This programme is fairly new and was established in 2018, but our institute has over 20 years experience of providing postgraduate taught education as we run another 2 MSc courses and an MRes course alongside this one. So as you know, UCL is a large global university with more than 13,000 staff and 42,000 students from 150 different countries. We operate in a global context and are committed to excellence, innovation, and the promotion of global understanding in all of our activities, whether that be in research, teaching, learning, enterprise, or community engagement. The Institute of Women's Health is situated within the Faculty of Population Health Sciences here at UCL. Our mission at the Institute is to bring together the expertise of clinicians and researchers from a diverse range of disciplines so that they can deliver excellence and innovation in research, clinical practice, education and training in order to make a real and sustainable difference to women's and babies' health locally, nationally and worldwide. The Institute for Women's Health itself is split into 4 research departments: reproductive health, maternal and fetal medicine, women's cancer, and neonatology. Here you can see some idea of the wide range of research areas our staff and students are involved in, from sexual and reproductive health to gene transfer technologies in the fetus, to women's cancers and neuroprotection in preterm infants. So the MSc in Women's Health can be taken full-time over an academic year from September to September, part-time over 2 years, or in a modular flexible route in 2 to 5 years. The MSc is made up of 8 taught modules, 4 core or compulsory modules, and 4 optional ones, and then 1 research project or dissertation. We begin the programme with an introduction week where you're introduced to UCL, to the Institute, to some key staff at the Institute, and of course to each other. We'll also talk about some of the key skills you'll learn, such as presentation skills, writing skills, and networking. Each module hosted at the Institute runs over 3 weeks. It does depend on the module, but they usually have between 2 and 4 days of teaching each week. Some of the optional modules hosted by other departments are organised differently and run as long, thin modules. This means they run for the whole of a term, but with only 1 morning, afternoon, or a whole day of teaching each week. Very roughly, each module requires about 150 hours of study time, but that includes the pre-reading for the module, lectures and tutorials, and preparing for and writing your assessments. The 4 compulsory modules will provide you with a broad understanding of the central themes in women's health. So the first module you will take at the beginning of term 1 is Understanding Research in Women's Health. This aims to provide you with the skills and knowledge to make sense of women's healthcare research and innovations in practice. It's not a research methods module, but it does look at different study designs and examines various perspectives on research and governance in the field. Your second core module, also in term 1, is Female Reproductive Anatomy, Physiology and Pathology. This module discusses all aspects of female anatomy, physiology and pathology during the life course of a woman, from puberty to menopause. So you'll study topics such as embryology, histology, histopathology and anatomy of the female reproductive system, hormones, puberty and the menstrual cycle, menopause, and disorders of sexual development. And then in term 2, you'll take 2 further core modules. Concepts and Controversies in Women's Health will introduce you to some of the main concepts in women's health, both in the UK and globally. Subjects like inequality, intersectionality, and the politics of reproduction. We invite expert speakers to discuss specific controversial issues to demonstrate these concepts. In the past, this has included lectures on such topics as FGM, female genital mutilation, gender identity, mental health issues, and gender bias in medicine. In your final core module, Legal and Ethical Aspects of Women's Health, module leads will guide you through the ethico-legal challenges in a range of areas of women's health and social care. This might include topics such as control of fertility, assisted reproduction, surrogacy, pregnancy and childbirth, and abortion. For your 4 optional taught modules, you are able to choose from a selection of topics across the university. Our website has an up-to-date list of the modules available, but this includes topics like health inequalities over the life course, pregnancy and childbirth, reproductive health, and gender and global health. Your combination of modules is of course somewhat limited by timetabling and availability, but I'm happy to discuss your options to make sure we make the best fit for your academic background and for your future career aspirations. Each module is of course assessed, but there's a wide variety of assessment types used, including essays, exams, written reports or case studies, critical reviews, and presentations. There are lots of different types of research projects you can undertake depending on your interests, your previous background, or your future career plans. Projects can take the form of a narrative or comprehensive review. They can involve laboratory work or the analysis of pre-existing data. They can be clinical or applied health research, or they can involve data collection and analysis using questionnaires, surveys, focus groups, or interviews. There will be a selection of projects which are on offer from academics at the Institute. You're also encouraged to approach lecturers whose work you're interested in, or you can develop your own ideas as long as we can find a suitable Institute supervisor for you. One of the best things about our programme is the wide range of students that take the course. They have a mixture of academic and clinical backgrounds. We have medics and other health professionals, including nurses and midwives, and those that have studied biological subjects, such as biomedical sciences and neuroscience. We also have students from different backgrounds, which so far include those who have studied psychology, global health, international relations, and public health. We also have students with many different personal circumstances. Around 2/3 of students take the course full-time, but we also have a significant proportion who study part-time or more flexibly, whether this be due to their caring responsibilities or working part-time. We're a truly global institute and our students come from all over the world. In fact, last year we had postgraduate taught students from 21 different countries. Throughout the year, the Institute also runs a comprehensive careers programme where we invite people working in different job fields, often alumni of the various master's programmes, to come and speak to you about their career pathways. Because it's such a new programme, we only have a little bit of data about what careers students go on to do after the course. So far, some have either returned to their clinical practice or to their jobs as midwives and nurses. Some have gone on to roles involving further research or ethical and regulatory positions. To find out more about the programme, please look at the Institute website. If you have any specific questions, please email either myself or our administration team. You can also follow both the Institute and myself on social media. Thank you for listening.